On Chapter 15, page 89, Patient-Centered Care and Nursing Care for Stroke. Monitor vital signs every 1 to 2 hours. Notify the doctor immediately if blood pressure exceeds a systolic greater than 180 or a diastolic greater than 110. This can indicate the client is experiencing an ischemic stroke. Monitor the client's temperature. A fever can cause an increase in intracranial pressure. Provide oxygen therapy to maintain oxygen saturation levels greater than 92%, or if the client's level of consciousness is decreased. Place the client on a cardiac monitor to detect arrhythmias. Conduct a cardiac assessment and auscultate apical heart rate to detect murmurs or irregularity. Monitor for changes in level of consciousness that indicate increased ICP. Monitor vital signs and electrocardiogram. Monitor for hyperglycemia, which is associated with poor neurologic outcome, hyperglycemia. Elevate the head of the bed approximately 30 degrees to reduce ICP and to promote venous drainage. Avoid extreme flexion or extension of the neck and maintain the client's head in the midline neutral position. Initiate seizure precautions. Assist the client's communication skills if speech is impaired. Assess the ability to understand speech by asking the client to follow simple commands. Observe for consistently affirmative answers when the client actually does not comprehend what is being said. Assess accuracy of yes or no responses in relation to closed-ended questions. Supply the client with a picture board of commonly requested items or needs. For expressive and receptive aphasia, speak slowly and clearly. Use one-step commands. Assist with safe feeding. Assess swallowing and gag reflexes before feeding. The speech-language pathologist SLP may request a swallowing study that can involve swallowing a barium substrate and radiography of the peristaltic activity of the esophagus. 4 liquid consistencies have been identified by a collaborative group of specialists for clients who have dysphagia. Thin, water juice, nectar-like cream, soups, nectars, honey-like honey, yogurt, and spoon-thick pudding, cooked cereals. Food levels for dysphagia include pureed, mechanically altered, advanced, mechanically soft, and regular. Use the appropriate consistency and food type as recommended by the SLP to minimize choking. Have the client eat in an upright position and swallow with the head and neck flexed slightly forward. Place food in the back of the mouth on the unaffected side. Have suction on standby. Maintain a distraction-free environment during meals. Collaborate with dietitian to ensure appropriate caloric intake because weight loss is common following stroke. Prevent complications of immobility, like atelectasis, collapsed lungs, pneumonia, pressure injuries, and deep vein thrombosis, DVTs. Clients who have experienced strokes are ambulated as soon as possible to prevent complications. However, during periods of inactivity, preventative measures related to complications of immobility should be implemented. If the client has one-sided neglect, teach them to protect and care for the affected extremity to avoid injuring it in the wheel of the wheelchair or smashing it against a doorway. Encourage range of motion exercises every 2 hours. Active for unaffected extremities, passive for affected. Elevate affected extremities to promote venous return and reduce swelling. An elastic glove can be placed on the affected hand if swelling is severe. That completes page 89. Moving on to page 90 in Chapter 15, ATI, Stroke. Maintain a safe environment to reduce the risk of falls. Assistive devices, transfer belts, and sliding boards should be used during transfers. Sit-to-stand lifts can also facilitate transfers and reduce strain on the care provider's body. If the client has homonymous hemianopsia, loss of the same visual field in both eyes, instruct them to use a scanning technique, turning head from the direction of the unaffected side to the affected side when eating and ambulating. Provide assistance with ADLs as needed. Instruct the client to dress the affected side first and sit in a supportive chair that aids imbalance. Remember, address affected side first. DA, have occupational therapy assess the client for adaptive aids, a plate guard, utensils with built-up handles, a reaching tool to pick things up, and shirts and shoes that have hook and loop fasteners or tape instead of buttons and ties. Clients who have experienced stroke have decreased endurance and impaired balance due to paralysis on one side of the body. Provide frequent rest periods from sitting on the wheelchair by returning the client to bed after therapies and meals. When sitting the client up in bed or in the wheelchair, leaning to the affected side typically occurs and should be countered with some manner of support. Shoulder subluxation can occur if the affected arm is not supported. The weight of the arm is such that it can cause a painful dislocation of the shoulder from its socket. Support the client during periods of emotional lability and depression. Client education. Use the unaffected side to exercise the affected side of the body. For edema of the extremities, massage by stroking from the fingertips or toes back towards the body to encourage fluid movement. And support the arm while in bed, the wheelchair, or during ambulation with an arm sling or strategically placed pillows. This completes the patient-centered care, nursing care for stroke on page 90. We'll move on next with medications.